So you're thinking about having a rhinoplasty and you're understandably curious about what to expect in the months following your surgery. This may be because you've had previous injury or you're simply unhappy with the way the nose looks. Before reshaping the nose, it's important to consider a few things, preparing for the surgery mentally and physically. The surgery will not give you instant final results, and you have to be patient for things to settle down. You may not get a dramatic response from your friends. And even when the swelling has gone down, you may not get a dramatic response from your friends and family. In fact, many may not even notice. They may notice something different about you, and you will hopefully look better, but they will not be able to put a finger on what it is. Try and decide what you would like to change about your nose. During your consultation, you may know you don't like your nose, but you're not sure exactly why. We'll try and be specific and analyze specific areas of the nose that we can potentially change. So how do you prepare for something like this? Generally, preparation is mentally just as well as physically. Physically, you need to stop smoking. If you're on any blood thinners, stop taking those. No long haul flight, and be prepared for a recovery period. Mentally understand why you want to have the rhinoplasty. Is it because of social media? Consider how phones and Zoom can deform your appearance, and I'll be honest about this. So we will take realistic photographs, and we can also discuss social media. I'll take photos and base our ideas on the realistic photos. It's important to have realistic expectations about what we can both achieve. So let's look at the timeline. Immediately after the surgery, you will notice some swelling and bruising developing around the face and in the eye region. I will advise you not to do any heavy lifting and bending over in the first 2 weeks. Keep your wound dry and wash your face gently. I will also advise you on a soft diet, and the splint that I provide will need to stay intact for a week. Once a splint is removed, this will be replaced with soft tape. You will be very swollen at this stage, so don't judge your nose. I would advise you that you will probably be restaurant ready around 3 weeks, where you'll be presentable, but you will still be swollen. I will also advise no exercise for about 6 weeks, but you will be able to go on gentle walks. Like I said, you will still be swollen at this stage. At 3 months, you should be able to see some positive improvements. You'll feel more comfortable in going back to your normal activities, but you must understand the swelling will still be present at this stage, and any fine changes to the nose will still not be present. Hopefully, the bruising will have gone completely, and there may be some minimal swelling around the eyes. You should be able to breathe normally through your nose, but your nose may still feel sensitive to touch. Overall, the appearance should have been improved. However, the final result is still not present, and it's important to be patient even at 3 months. At 6 months, the healing process is well underway. The swelling should be greatly reduced, and you should be able to see the final shape coming on, but there will be some swelling that needs to improve. If there is a significant amount of swelling that I am unhappy with, I may use some steroids at this point to help speed things up. You should be going back to your normal activities, but you may notice if you do some heavy activities that nose swells up again, and I would advise you to put the tape on at night. At 12 months, this is considered the time frame where you should have your final results. Very few people still have some swelling present, and again, we will make a decision whether you need to continue with some steroids at this stage. But most patients are happy and are delighted with the outcome. I will schedule an appointment also at a year's time to make sure everything is okay. A rhinoplasty procedure is a procedure that requires a lot of patience, particularly with swelling. Your personal healing process may vary based on factors such as the complexity of the surgery, whether this is a revision, your body's natural healing process, whether you've had any previous trauma in the past. So we will decide on things based on you as an individual. So we're going to go through some of the risks of surgery, and the one that is the most common and you need to be aware of, and I've emphasized, is the swelling. The swelling does last a very long time, particularly if you've had previous surgery. There's always a risk of infection. You will ooze through the nostrils in the first 24-48 hours, but this does settle down. You will have some scarring at the base of the nose, and it's very small, but sometimes these do become prominent. You will have some numbness, particularly at the tip of the nose, and your nose may feel cold first when you go outside, and you may have some diminished sensation in the nostril area. You'll notice some skin pores appear larger than normal after a rhinoplasty procedure, and this is because of the swelling, particularly. And if you have any thread veins, these can also become obvious. When you run your finger from the top of the nose to the base, you may notice some bumpiness, and this is completely normal and is part of the process of the surgery where you can feel parts of the bones and the soft tissue, but you can't see them. You're more likely to feel them. Other risks include damage to deeper structures, including the TED, but this is rare, and if this happens, we will transfer you over to the main hospital to have it corrected. In rare situations, there can be what we call a septal perforation. This is when there's a tiny hole in the septum and it can affect your breathing and cause airway alteration. But we will keep an eye out for this. The other risk that we need to be aware of is unsatisfactory results. That's why it's so important for us to have an open discussion to see what we can change and what we can't. At least we are able to manage expectations prior to the surgery. There's always a risk of an allergic reaction, delayed healing, and also long-term effects as you age, as you put on weight, as you lose weight, sun exposure. All these things can affect the shape of the nose. If you are a singer or an actress or an actor, it's important to be aware that your airway or your voice can change because of the nasal alteration. I hope this helps you make a decision in whether you want to have the surgery and you are fully informed with the rhinoplasty procedure before you go ahead. If you have any questions, if you'd like to see me, contact us and we can show you some before and after pictures and see whether this is a procedure for you.